So take a look at modules 4 and 5. They're the next two, and there's videos that go along with them that explain them. But like I said, all of those are designed to be done really on your own. Um, but again, questions about any of that stuff, please feel free to bring it to class. The next quiz has been opened. I give you 40 minutes for it. It's concerning modules 4 and 5. As per normal, feel free to have your notes out, book out, all that good stuff, because it's a review. It is just really meant for a review. Let's hop into post-embalming treatments. Like I said, in this class, it's a weird thing. Once we get outside of chemistry, things get a little bit easier. Once we finish that last unit, which is moisture considerations, edema versus dehydration, that type of a thing, then we will have, really we'll be at the tail end of the class. So one of the things I want for the next class, which is the 21st, because next week we're not there, is I'd like to have the teams together for the project. If you remember, it's teams of 4 or less people, and then you just need to answer one of the questions on there as far as how would you embalm this particular decedent. And if you look at the info for first day, then it's that project is outlined there. It's pretty straightforward, but we just want you to think about different ways to embalm and that type of a thing. Yeah, it's you never know. You just never know what you're going to get. I had a decedent over the weekend that was very, very big, and oh, it was a lot. So you just never know what's going to come through the door. So we want you to have to think about these things critically. All right, so oh, there it is. All right, so post-embalming treatments, we ended up with, give me a second here, with subcutaneous emphysema. There we go. And we talked about this in class, and the idea that this mirrors tissue gas. It's not the same thing. It's not going to destroy a body as quick as it won't destroy a body. It's not like tissue gas. But if you find that you have that crepitation, like I said last week, it normally will show up right up in the chest. Take a Sharpie or something and draw a circle around that area and see if it grows. Give it 5-10 minutes. And if it grows, now you're in trouble. Oh, hold on. I'm still on call apparently for the funeral home. Give me a second. Let me forward this to okay. Sorry about that. I guess I never changed ASD. But yeah, you draw a circle around it, you give it 5-10 minutes, and you'll know if you have tissue gas or not. And again, if you have tissue gas, it is all hands on deck. Like, get started. It's you got to neutralize that as fast as humanly possible. Subcutaneous emphysema is not the same thing. You just need to get the air out of the tissue, which you can do by lancing or even just cutting the area and getting the air out. All right, resetting and gluing. This is something you'll do on a regular basis. You may have to, the features can be corrected post-embalming. I had a body once where, God, it was a very nice family, but they were so meticulous. They were so thorough. Why is ASD texting me again? Hold on. If I don't write them back, they will. All right, hold on. Here's what we're going to do. Give me a second here. Wording. So anyway, yeah. So I had a body once that it was a very nice family. They were you could eat off of their floor. The place was meticulous, and they were very meticulous in the way that they were just very thorough and everything. And the call came in when my wife and I drove to the shore. My mom had a shore house, and we were going down for the weekend. We drive into town in Avalon or wherever it was, and we put the call on. So I had to call another funeral home to do the removal, and out of courtesy, you normally go, okay, do the prep as well. And when we came back and I went to get the decedent, like I pulled the sheet back and I was like, I couldn't believe how bad the body looked. Like the mouth was basically open. It looked terrible. I was like, oh, this ain't good. And if you're in a situation, especially if you get a body out of like Florida or something, because Florida is just known for having really bad bodies. Like they just do not do very good work down there. I'm not saying everybody, I'm just saying it's a common complaint. You can reset those features, and we did. We took hours to do, but you can do that. It's more difficult, but it can be done. Um, so cotton or mortuary putty can be used to fill out emaciated or sunken cheeks. And this is a lot of times people will go in to put cotton in the mouth down here. What I find a lot of times, if you put cotton down here or mortuary putty, like pose down to the bottom lip, you can get it to pop up a little bit so it comes together naturally, sort of the way that your mouth would naturally do it if your muscles were moving, but they're inanimate at the time. Um, Wet cotton should be replaced with dry cotton. If you have embalmed someone, and fill the whole mouth with cotton, get the features looking right, and you embalm them, they're purging, get them out of there and get hold on, give me a second. So again, if that cotton gets wet, if there's purge in it, again, I think we talked about this in class. I always confuse embalming one, embalming two, and what we've talked about because there's a lot of overlap between the two. But we get desensitized to these smells and these odors and things like that. Somebody leans down to give mom or grandmom or whomever a kiss goodbye, and there's a mouthful of this cotton in there that has purge in it. They're going to smell it. They're going to notice it. Even if you've glued the mouth shut, the odors will come through the nose. So yeah, you got to get all that stuff out. Um, the eyelids, the palpebra, and the lips can be gently manipulated with an aneurysm hook. Always be careful after the fact, after you've embalmed someone. Michelle's saying, I do tissue builder by the chin to lift the bottom lip up. And that works too. That's a great technique. Yeah, absolutely. A wonderful technique to do that. A bunch of ways you can do it, but it's good to have multiple plays in your playbook. So sometimes it's going to work, other times not, other times cotton's not going to work. So yeah, no, but that works fantastic. So after somebody's been embalmed, you always want to be very, very careful with the lips and the eyelids in particular, because the eyelids have been dehydrated at that point. Like I've said in class a bunch of times, that inner canthus right in here, you always want to make sure that that is closed. Make sure if need be, you can glue it. And I always say to take a pin, like a hat pin, and put a little drop of glue on it, or Aran Alpha or whatever you're using, and just put it right into that area. Make sure that it's shut. If it's open, especially during the summer when you've got air conditioners on.
I'm here.
Okay, well, thanks for announcing.
I got to make my entrance, Professor Dale. I do.
It wouldn't be the same if you didn't. All right, let me get back to this, Willie. So anyway, so yeah, you want to glue that down if need be. Sometimes, like I find that with the eyelids in particular, I find like pre-embalming, I have a hard time getting them shut if I'm taking Vaseline or whatever and trying to put it on there. It sticks to the glove, so it's always good to be good with the instruments. Aneurysm hooks in particular, you can take a little bit and just put a dab there and get it shut for you. But it's something that needs attention, something you should pay attention pre-embalming, post-embalming, to make sure that it's properly handled. Same is true with the mouth. If you have to, you can close the mouth with glue, but you want to be careful with that. You don't want the mouth to be stretched out. We very big funeral that we had where it was a gentleman who was a local car dealer, and he was one of these people. He was larger than life, and he died down in Florida unexpectedly. And when he came in, and the sons came in, and I've known them since I was a kid, and they were there when the body came in and was shipped in, and his mouth, he was like pulled, like looked like the mouth was glued. And they're like, is that mouth glued? And I was like, yeah, I think so. I was like, we'll fix it. But you don't want to have that look. You always want it to look natural. So mouth, keep tissue adhesive behind the weather line. And again, that weather line right on the lips where they meet up. I just did it Saturday with a decedent where it was, you put a little bit of glue in there and the mouth just was not coming together. Younger gentleman was missing his teeth. I think he was in a car accident in his teen years. And, it was just difficult to get it to line up, but you always want to go behind that weather line. And if you have to, like a lot of times I'll take like a paper towel, I'll pull the lip out like that to get it to line up properly. And again, like I was saying, man, that's the first thing you're going to hear from families if there's an issue. The mouth doesn't look right. It's the first place the eyes go when you look at somebody who is not somebody who's dead, but somebody whose eyes are closed. If you look at somebody and they're sleeping, you're for some reason your eyes go to the mouth, and I've never understood why. All right, so plastic garments. Um, Again, be sure the body is thoroughly dried before you use them. And if in doubt, use the plastic garments. They can be a pain in the rear to get on, especially if you're dealing with a union. I've talked about this in class. You've probably heard me say it. There's so many times you'll get all the way up and you're pulling the union up and it tears. And you're like, oh, damn it. And now you got to start over. But it's better to get it on if you're going to have, if you think there's going to be an issue, use the plastic garments. And dry the person down beforehand. You don't want moisture in there that's not there beforehand. Now, if you're dealing with edema and moisture comes, okay, fine, whatever. But you want to make sure the body is dry before it goes in. If you're using a sleeve or pants or a jacket or whatever the plastics are that you're using. Otherwise, mold can grow, and it can actually grow in that environment relatively quickly, and it's the last thing you want. Sprinkle embalming powder into the garments. If you're going that far as to put the decedent in plastics, make sure to put some powder in there, a little embalming powder, a little bit of, if need be, a deodorizing powder or an absorbative powder, depending on the situation and what you're dealing. So again, this protects the clothes from anal perch, and anal perch, you want to get as much out of them as possible. Fancy word for poo. That has an odor to it, so you want to try and make sure to get on it. You'd rather deal with that on the prep table than in the casket. Decubitus ulcerations, bed sores, they smell atrocious. They can smell atrocious, and you want to treat them pre-embalming, during the embalming, and post-embalming. With traumatic injuries, lesions, etc. Plastics come in very handy. Always use a garment that is slightly larger than necessary. This is the same thing you guys have me in for lab. If you normally wear a medium, as far as like the moon suit that we put on, I know it's like get a large. You want a little extra room there. And it's not a bad idea to tape it down. There's that really strange law in New Jersey that came out, I would say in 2019. A family went in, viewed someone, and they could see the plastic like in the sleeve or something. And they put a complaint in with the State Board of Mortuary Science. And the state board just decided to change a regulation. They said, well, now every funeral home can't just have duct tape to do this. You need to have clear or flesh colored tape. And then all the funeral directors said, well, what the hell is flesh colored? How do you define that? And then, well, you could figure it out based on whoever you serve. I was like, oh, okay, that makes a lot of sense. But that's why we have to have clear tape, at funeral homes, clear or white or quote unquote flesh colored. And the family saw it, but it's not a bad idea to tape everything down. Otherwise, if they touch someone, they can sometimes feel the plastic underneath of them. So examples of them, and again, none of these make sense. Like sleeves make sense, stockings make sense. Capri pants doesn't make sense. Capri pants are like footy pajamas, right? Like they've got the little feet on them, right? Pre-plants, if you go to a store and buy some, they're like floods, right? Like they only go down to like your ankle or something. It's I don't know why they name them this way. A coverall doesn't really cover all. A coverall only covers really up to the chest and then down to the knees, whereas a union does cover all. So I don't know who came up with these terms, but they don't make sense. All right, so documentation. The embalming case report, and again, regardless of what you do at your funeral home, I know some funeral homes do this, some don't. You should do them. It's not a bad idea. With as litigious as the world is, if you ever get called in to because somebody is going to sue the funeral home or something, it's good to have this. Didn't see the email, so he's not going to make the Zoom today. Okay, that's fine. Um, it's a, regardless of what you do, because of the curriculum and the way they have it spelled out, technically an embalming is not done until you do the embalming report, right? So an embalming you did a year and a half ago and the person's been buried or cremated or whatever, technically the embalming is not done according to the curriculum because you haven't done an embalming report. And again, I don't care what you do on your own, but just for academic purposes, think of it that way. But so embalming case report filled out for each body prepared and for each body received from another funeral home. So even if you get a body that is embalmed in Florida and then shipped up to you, you still want to do a case report on them. You want to note pre-embalming conditions, personal property received. And personal property is a big deal because you want to create a chain of custody with that. I can't tell you how many times I've gotten a call from a family saying, well, mom's earrings are missing. And then you're ripping the place apart for an hour. I remember one time it was that exact scenario. And I'm going through the medical waste. I'm going through the trash cans. I'm ripping everything apart, looking for this thing. I'm going down into the sink, trying to pull out the bottom pieces of it to see if there's anything in the trap on it. And I eventually called them back. I was looking for like an hour and a half. And they were like, oh, yeah, we found them like 5 minutes after we got off the phone with you. Oh, well, thanks for the phone call, people. So it's good to have that chain of custody so you know what the hell you're taking into your care. I know Samaritan Hospice, I shouldn't say the hospice name, a hospice. One time they wanted us to take everything in the room at one of the hospice facilities, and it wasn't at a house; it was at a hospice facility in a hospital. And it was like, what are you crazy? Like, and what they wanted to do is they wanted to get that room cleared out as fast as possible so they could just get somebody else in there. And I was like, no, like I'm not taking all this. I don't have a list of what is in there. Like, and they tried to spin it that like, yeah, why would you make the family come down here? And I'm not making them do anything, but I can't take all of their stuff because I can't be responsible for it. Something goes wrong and something gets lost or whatever, or something was already lost and now it's not coming back, but then that's on me in the funeral home. So you have to be really wary on that. But again, all of this comes into this documentation. Your pre-embalming conditions, treatments performed at the funeral home. What exactly did you do? Autopsy, and this is a weird one, but it's in the curriculum. Note of viscera were returned from the hospital or morgue. I've never seen a case where it wasn't. There are times that maybe a particular organ doesn't come back because they're still doing testing on it, or there is. I one time had to drive up to a hospital to get a piece of a skull that they had done brain surgery on this person. They had passed, but the family wanted that piece of skull returned. We had to go and get that and get it. So it's good to have a list of what came back, what didn't, what are you responsible for. Know the organs and or tissues removed due to autopsy or donation. And again, if you're dealing with, and again, in class, I would normally ask if anybody ever dealt with a long bone donor or a skin donor. It's good to make notes of all of this. That's a ton of work, and it all goes to a good thing, good purposes, but it's a lot of work. But you should know what you have, what you don't, what condition the body is in. And again, I always go back to that thing of thinking about being deposed. And for anybody who's ever been deposed, an attorney will sit you down and they will question you about the smallest thing. I remember being deposed with a woman that fell down out front of the funeral home, and he was asking me how big the stairs were at the funeral home, and I'm like, how would I know that? Well, what's in the basement of the funeral home? Like, what does that have to do? Like, they will get into minutia on this, and they make it intentionally difficult. That's what they do. It's It's an angle, let's say. It's a shipping. Um, okay, there. Sorry, I just had a little issue with my computer there. Plastic garments should normally be used on the decedent that are being shipped. You know, again, especially if they're going on a plane, you never know what type of. Think about it. You're not in the pressurized cabin, so you have to keep that in mind. You know, so it's good to have plastic garments because, and it's not a bad idea to just cover everything in plastic because you, especially if they're in a casket, you don't want to take a chance of them purging on something. If there's no clothes, you should at least put a hospital gown or pajamas or something on them. I mean, think about the idea that we need to take care of these decedents and show them the respect that they're due. Um, Positioning, hands should be on the abdomen, but not on top of each other. And this is the way most people lay bodies out. The problem is if you're shipping, especially by airline, they may move on top of each other like that during turbulence or something. I was on a flight a couple of years ago and we hit this pocket of turbulence that you wouldn't believe. And I'm not good at flying because I'm not good. I do not like it. And you know, it was so bad they had just given me a cup of coffee and the lady took the cup of coffee and set it down on the floor. And then the one, I'm going to say stewardess. I know that's not the proper term these days. She laid down on the floor and the other one sat in a seat with somebody else, like hooked him, like sat and hooked him. Like it was that bad. The plane was going crazy. And I'm like flipping out. I'm like, ma'am, like, is this normal? Is this normal? And she's like, and she's trying to stop panic because I'm not helping the situation. She's like, sorry, this is perfectly fine. It's perfectly fine. I was like, okay, but I mean, I was sitting there white knuckling it. The plane was just all over the place, and it was fine. But think about having a decedent in that situation, you know. So you don't want a situation where the hands can rub on top of one another. Oh, that was a scary one, man. Oh, God, I do not like flying. um, Anyway, massage cream and sort of the way the book puts it, use a small amount. I say more is better. You don't want to take a chance of anything drying out. If there is purge and it gets onto the face, you want to protect the face. You want to protect this body as much as you can. And it's not a bad idea to put massage cream on the hands as well, you know, and how long are they going to be? How long is the journey? We had a body once going to Brazil that got stuck in storage in a like in a warehouse for like 2 days. I mean, it was crazy. Um, Delta eventually, I think, paid someone off to get this body out of storage because it was a holiday, all this weird stuff. You never know. So always prepare for the worst. And avoid sealing the lips or the eyes in this situation. Put on a bunch of massage cream. But again, because of that change in pressure, if a plane is up 35,000 feet, you know, I've skydived twice in my life. I don't think I'll ever do it again. It was intense, but there's a place in Williamstown. If anyone's ever interested, I can give you the info. It's something I think everyone should maybe try at one point in their life. But and that was from 15,000 feet. And it's crazy. You fall for 60 seconds. You know, you fall for a full minute, and that's a long minute when you're just dropping at 130 miles an hour. And anyway, but like I couldn't hear anything for like 2 days just because of that change in pressure. You're not, again, a pressurized cabin. If you're on a 747 and it's running up at 35,000 feet, it's much different. And that pressure change is much more pronounced. So you don't want the lips sealed because you want air to be able to get in and out of it because of that pressure change. And again, don't seal the casket. If you've got a sealer, don't seal it. These are actual pictures of a casket that was shipped. And I had a student a couple of years ago that told me that they had a casket came in, it was shipped. They had the body fully up, and you also want to put the body in the complete the bed at the bottom position, completely get it down. Even if you have the head a little bit elevated over the feet, you want it down. And what happened was they had shipped the body, they received the body that was shipped to them, and the body was at the top, and they sealed it, and the whole thing crushed down. It ruined the casket, and it did all sorts of damage to the body as well. So yeah, this is what happens if you end up sealing a casket. You don't want to seal it. And it's not a bad idea to bring the crank down or put the crank and maybe turn it once or twice just so it's not going to pop open. But you don't want that gasket completely sealed because of that pressure, that different pressure that they go through it when they're flying. All right, so monitoring the remains, right? So you receive a decedent, you embalm them. Funeral's not going to be for 2 weeks. You don't just put them in a corner and go, whatever, it's fine. Well, we did the prep. I'll check them out in 13 days from now. No, you want to check them like on a regular basis. You know, you want to make sure that they're not dehydrating, there's not leakage of some sort. You know, you want to make sure that they're in decent shape as you move forward. You may have to go in and do some hypo work or something on them, you know, at a later point. If maybe the left leg is not holding up the way you'd like to, maybe you need to go in and hypo inject, but you need to monitor them on a regular basis. And with every case that you deal with, you always want to examine before and after the visitation. And there'll be times that people come in, and this is one of the big arguments for using airbrush. Because if you put airbrush makeup onto someone, then that's not coming off. I mean, you can get it off, but it's not just going to come off by touch. And there'll be times you'll have someone, they'll have a big bruise in their hand. You put a bunch of makeup on there, and then people come up and they put their hand on them just to say goodbye to them. And some of that makeup wears off. And over time, it's just, you'll come up and that complete bruise will be back. If you're doing like a 7 to 9, right? And at 9, you go and you're looking, oh no, I got to update this makeup. So before and after every visitation, you always want to make sure the body is in the shape that it's supposed to be. You know, the mouth may have opened, the lips may have come apart the way that, you know, you take all this time, you get them just perfect. Somebody kisses them, which is fine, you know, but now the lips are messed up. You know, you always want to monitor the remains as you go along. I came down one morning when we were living at the funeral home, and the whole backside of the casket, the elbow started leaking. We had not foreseen this coming, and the whole back of the casket, it had wicked up it, and it's like like, so you just never know what you're going to walk into, you know. So, you know, again, your post embalming concerns, your, you know, dehydration, purge, leakage, softening and discoloring of the tissues, gas formation, separation of the lips or the eyelids. Odors is a bad one. Sometimes even if, let's say you do a 7 and 9, you come up, you smell something's a little bit off, it's not a bad idea to get the lift, pull the body completely out of the casket, do a complete rundown on what's going on here, and get them where they need to be for the next day. In cosmetic issues, cosmetic corrections, you know. So hold on, give me a second here. There we are. So cosmetic corrections. So color changes may occur in the face, neck, hands, or arms. You know, treatment of this, you know, hypodermic injection of undiluted cavity fluid or a surface compress. A surface compress goes a long way. Or if you just want to directly inject like phenol into a bruise or something to try and bleach it down a bit. Opaque cosmetic or as an undercoat, and then you can apply cream cosmetic. Now, the book makes it out like, oh yeah, you just use a heavy opaque cosmetic. Sometimes it's warranted. A lot of times there are bodies that are overdone with cosmetics. I worked at a funeral home once that when I first got there, what they were doing, and I didn't make the changes. It was something that the whole staff did, but the environment they had was just pouring so much cosmetic onto the people. I mean, he was basically, even with men, he was putting on this heavy foundation and then just drawing the lips on, like everybody looked like the Joker. I mean, it was insanity, you know. And over time, we got them to switch a little bit, you know, myself and another director. And it's sometimes you need to use an opaque cosmetic, but a lot of times remember with cosmetics, less is more. If you can notice the cosmetic, then you've used too much. When I was an intern, there was a body, I've probably told this story in class. The person died in Las Vegas behind a hotel and behind one of the casinos, and he wasn't found for a couple of hours, and his face was, I mean, black like like my phone, and my preceptor basically just took the heavy duty opaque stuff. It's almost like a spray paint, and he just sprayed it onto the person. Got him looking as good as he could. Actually, all things considered, it wasn't bad, but yeah, it's not something you want to do on a regular basis. The book sometimes, like I said, makes it out like, oh yeah, it's perfectly fine. Just dump a whole bunch on them. All right, so separated tissues. So the lips and eyelids may separate sometimes due to dehydration, sometimes if they're improperly closed, sometimes movement during transportation. Again, you can gently massage these to get them where you need them to be. You always want to be careful when you're dealing specifically with eyes after the person's been embalmed. I was 24 when I went through the program, and I remember I was down working on a decedent, and the eye wasn't right, and I was taking the aneurysm hook, and I was going in and moving around. My mom started yelling at me. She's like, "Don't touch that eye. You need to be careful." Like, I was 24 years old. I thought I was going to get grounded. Like, it was one of those crazy things. But she was right. You have to be very, very careful when you're dealing with somebody's eyelids, in particular after they've been embalmed. That tissue firms up, and I mean, get the eyelid closed, but be gentle with it and take your time. Patience in these situations. Clean contact surfaces and then apply an adhesive. So let's say somebody's eyelid isn't where you want it to be. Take dry wash or whatever your cleaning agent is, and clean that area out and get anything that's in there. You want to get it out. And then again, you can just take, and again, this works so good. Use a pin, a hat pin. You just take a bit of super glue. You put it on the pin. It'll run down the pin, and right at the end, you can put it in the eye and slide it across and close it. Because again, I've mentioned this in class. You have to be really careful with the eyelids, or with the eyelashes, excuse me. If you pull back wrong, it can pull that entire eyelash off. If you've done the gluing wrong, so you always want to be conscious of that. Tissue builder can be used on the lips, and this is what Michelle was saying earlier. You can go back in, use the tissue builder on the lips. I would say use a really, really, really small needle if you're doing this. If you're using one of these needles that's like this long, you can mess up and make the lips like too plump. But if you use a real tiny one, you can just go in and get that lip right where it needs to go. A lot of times lips will dehydrate, and you can bring back the fullness of them and using tissue builder. But again, remember, tissue builder really can't be undone. So small little incremental bits to put in there, very small. You don't want to go in there going crazy with it. Even if it needs a lot, do it in small increments. All right, so leakage. Again, like I was saying before, there was a day I came down. It's happened to me 2 or 3 times in my career where I came down and there was a decedent and it leaked in the casket, and now you're rushing to try and clean that whole thing up and make sure that you can stop this issue. Predisposing conditions, trauma to the face or hands, cranial autopsy. I've only had, I would say, 4 or 5 bodies that I've embalmed that were head posts that didn't leak. I stink at closing the head, man. It's same thing as like the interdermal suture. So I stink at it, If that's the case, if you're concerned about it, so it's good to put something under the head, even if it's plastic, or if you take a towel or something and put it under the head, and when you lay them in the casket, you can hide that and the families won't notice it, but hopefully that way they're not going to leak into the casket. Autopsy sutures, surgical sutures, sutures where vessels were raised for injection, cases of edema. And again, it's always best to try and get it. And we'll talk about this in the next unit. It's best to get as much of that edema out of there as possible beforehand. Intravenous punctures, punctures with medical devices, trocar insertion, etc. And anytime you have broken tissue. So intravenous punctures, what you want to do is dry the area, and what they suggest is to inject phenol into it. You can take phenol and put it right in there. If you have an IV, and you can inject it right into it, and it will basically seal that area off. It'll cauterize the tissue basically, and then you want to put some sort of an adhesive over top of it. Similarly, with torn tissue, you can use a phenol surface compress or a cavity fluid compress, and you put it right on there because what you want is that firm and dry tissue. So let's say somebody had a big scrape down their arm or there's skin slip or something. You want to try and put that on there and dry that area out and get it where it needs to be, and then wrap it with plastic. Tissue adhesive or sealant can be put over top of it, dependent on the size of it. If someone's doing 130 miles an hour on a motorcycle and they tank and they slide down the road, it's probably going to be larger than you can do with an adhesive, and you're going to bring plastics into it and all of that. But if it's a small enough area, you can just put a little bit of, you can dry it out, treat it chemically, and then go on with some sort of a sealant over top of it. So incision sites, you want to open them, dry them, ligate the vessels. And this is a thing that I see a lot of students, even a lot of directors not doing, wherein like the suggested way to do this is to, let's say you're raising the carotid and the jugular. If you put in 4 pieces of ligature, right? One going up, one going down on the carotid, one going up, and one going down on the jugular. When you're done, you can tie off all 4 of those. And I see a lot of times where people just put on one and one, and it works for the embalming, but by putting that second one on, you do seal that off, and it makes it less of a chance it's going to less of a chance you're going to have issues with leakage. It's a good idea to tie all of those down. Even if you're using like just a clamp or whatever, it's fine. Or hemostat, locking arterial hemostat, I should use the proper terminology. It's still not a bad idea to go back in with ligature after the fact and tie everything down, seal it off, ligate it, so that it is, like I said, less of a chance that you're going to have leakage issues. So, so again, and then if you're having issues with leakage, it's not a bad idea about back in, maybe resuture, make sure to use sealing powder. Maybe the incision, or excuse me, the suture that you used wasn't as tight as you would like it to be. Maybe it's too big of a bite between each of the passes if you're doing the baseball. Maybe it's a situation where you need to go back in and switch it up altogether. Maybe do a whip suture or something like that. It's just, again, that whole idea of just assessing that situation and figuring out what's best for it. Plastic garments should be placed over treated non-viewable areas. You're obviously not going to want plastics around the neck or something like that. But if you have an issue with the left leg, great. The casket interior, you can protect that with sheets of plastic, especially if it's extended time until disposition or if you're shipping. I like to use the plastic that comes on top of the casket. You take that off, you put that in there, you can completely seal everything down. Now, the one thing I will point out is be careful if you're going into a church or an area with a lot of stairs. If somebody does have plastic underneath of them and you're going up, an area that has a decent grade to it as far as the elevation, they'll slide. Purge, again, if you're dealing with purge, always just reaspirate. It's not a bad idea to always reaspirate regardless. If there's gas, leave for several hours, then repeat the reaspiration, reinjection. Examine the mouth and nasal passages and reaspirate that and repack that if need be. If you're getting purge out of the mouth, make sure to take that nasal aspirator, clean the whole mouth out. Again, same idea before, cotton in there, get it all out, change it, and then just aspirate. You can't over aspirate. You got a situation like that, lips may need to be resealed, but again, that's on a case-by-case basis. Well, here comes one of my least favorite things on the planet: maggots. Oh man, this is something, and if we were in class, I'd ask if anybody has ever dealt with maggots. There's few things that really make me gag, but oh God, they're just disgusting. Ugh. In the summer months, you can get these. There was a student once that we had that she committed suicide in the woods, and it was unlike normally females don't use it like a shotgun when they commit suicide, but this particular person did, and she put the shotgun like right here and just, blast her face. It was brutal, but it was the summer months, and she was out in the woods, and they didn't find her for, it wasn't that long time, 6 or 7 hours, and just maggots all over the place, man. There was just what appeared to be thousands of them. It was so damn gross. But again, that's an extreme case most times, and you have to be careful to make sure not to have, not to have windows open so flies can get in and things like that. But what flies will do if they can get in is they'll get into the corners of like the eyes, inside the mouth, inside the nose, and then they'll lay their eggs. The You have to remove maggots with cotton, saturate it with a solvent. Basically what you have to do is you have to treat the area with the solvent, and they're under the tissue in a way, and you have to sort of get them to come out, and then you get them, you put them in a bag and get rid of them. You can use a vacuum cleaner for this as well to make sure that you've gotten them all. But if you do that, take the bag, take the vacuum cleaner bag or whatever, and get it out of the building. You don't want to be around it. You don't want to take these things home. This is a good idea that if you're dealing with that, you get home, leave your clothes in the garage or whatever, treat them separately, and you don't want to bring those things home, man. They're oh God, they're gross. Maggots in the hair and clothing can be removed. The vacuum cleaner, if they're on the hair, then again, get that bag, that vacuum bag out of there. If you're dealing with one of those vacuum cleaners, like my wife has a Dyson or whatever it is, and it's just a cylinder, treat the cylinder, take it out, spray it down with a hose, put bleach in it, whatever. You want to make sure you neutralize that. All right, so mold. You're not going to see a lot of mold in it's just not something you normally come across. Occasionally, once in a blue moon, but we normally don't hold decedents that long. And dealing with mold should be, body should be thoroughly dried to discourage mold growth. Remove the mold carefully with a scalpel or spatula. It's, you want to make sure to get it all off and then treat the area underneath of it. So I was talking about when Jen's grandfather died. We had him at the school for 2 months because he was going to Arlington National, and the students were allowed to come with us to see that. But she went to the school and viewed him one last time. And when the students brought him out, he was there for 2 months, and he was in a casket and refrigeration, but he had mold on his face. And the students were great, man. They cleaned it all off. But they scraped the mold off and then treated the tissue underneath of it after they got the physical mold off. Always be appreciative of them because it was a meaningful thing, especially for her. But something like I said, you're probably not going to see that much of unless you're dealing with like an Arlington situation. Again, like I said, once you get it off, swab it with phenol and then thoroughly dry with alcohol before applying cosmetics. And remember, anytime you use phenol, follow it up with alcohol after it's gotten where it needs to be, because the alcohol will neutralize the phenol at that point. It gets to stop working. Place embalming powder inside the plastic garments. And again, if you're using plastic garments, it's a good idea to use powder. All right, terminal disinfection of the equipment. The embalming machine, flush with warm water, and partially fill the machine to keep the gaskets moist. And there was a bit of an argument about that. OSHA for a while was saying, no, completely drain the machine. And they sort of went back on that. The idea is you completely drain the machine, the little rubber gaskets in there will dry out and it breaks your machine. So most people will keep, I don't know, a half gallon, a gallon maybe of water in the machine. It's not a bad idea to even put in like a water treatment, which will help clean the instruments in there. With surfaces, you want to use cool water and antiseptic soap. Disinfect with 10% sodium hydrochlorate and warm water solution. And sodium hydrochlorate is just bleach. Aspiration tubing should be soaked in a disinfectant solution, because think about how gross the tube hooked onto the aspirator is, onto the trocar. There's the old story. It's an old wives' tale, but of somebody who was hired at a funeral home, and they asked them to make coffee, and they went and they said, "Oh, where'd you fill the coffee pot up with?" It was like, "Oh, that hose in the prep room," and the people were drinking the coffee, and the water came through the aspirator hose. I'm sure that's never happened. I've heard that story so many times, but it's a gross thought though when you think about it. So you want to clean that out as much as possible. Instruments, you want to clean them prior to disinfection, meaning you want to take them, wash them, get all the if there's blood or anything else on them, you want to get all of that off before it goes into the cold. Most places we use a cold sanitizing bath in like a silver tray. And you let them soak in there overnight, and it neutralizes everything on there. But again, remember, those use quats. The sanitizing fluids that we use quats, and soap neutralizes that. So you just want to make sure to get all the soap off before you put it into that sanitizing, the sterilization bath. Again, after disinfection, rinse, dry, and properly store. All right, terminal disinfection of the embalmer. You just discard your gloves. If you're working at a place that's requiring you to reuse gloves, quit. That's crazy. But thoroughly wash hands after removing gloves. And again, this was something that I don't think we were all as aware of 2 years ago, but the old trick here, the rule of thumb is to wash your hands for 20 seconds or sing happy birthday twice in your head or out loud, whatever works for you. And that's what the recommended time for washing your hands is. Treat all cuts and punctures immediately. If you do cut yourself, if you do, let's say you use a needle and you accidentally stick yourself, first thing you want to do is you want to squeeze that area and get it bleeding. You want to get the blood out because that will bring a lot of, if there is anything that you're going to get sick from, that's going to bring some of that out. Disinfect the area and consult a physician if necessary. I've stabbed myself a couple times with suture needles or whatever, and the only one that ever concerned me was a guy that sort of had like track marks down his arm and things like that. And what you can do is you can if that happens, if you're in that situation and you're concerned, and if it's 6 of one, half dozen of the other, it's better to just do the medical treatment. You can contact an ER, let them know what's going on. They'll bring in, they'll give you a prophylaxis treatment. And the funeral home should pay for this because it's like a workers' comp thing. We in fact had this happen to one of our employees, and she had insurance, and she was like, "I'll just use the insurance." And the hospital was like, "No, you can't, because we know that it happened at the funeral home," which we didn't care. We're like, "It's fine, whatever, just get the treatment." And they'll basically give you like AZT, which is like the HIV cocktail, and it neutralizes almost everything in your system. It may make you sick for a couple of days, but if you're concerned, just go get it done. Being sick for 2 or 3 days is better than waking up 3 months from now going, should I have done that? Or, it's just the safer of the options. And I said, when in doubt, contact a physician and tell them the situation. Good. We got through that faster than I thought we would. Any questions about that? All right. Okay, good. None for you. Good. Then we're all on the same page. Let's do this. Let's take a look at the first couple of slides of the next unit. I don't want to get too far into it after, because what we're going to have is this next unit, moisture considerations. We'll have the third test, and then we will have the final exam. So we're pretty close to the end. Like I said, this class gets a little bit easier, I think, once we get through that first unit. Stop sharing. Hold on a second. All right. All right, so moisture considerations. This is, everything having to do with the amount of fluid inside of a body, and we see it both ways. We see it where you're going to get bodies that are why is this not opening? Oh, give me a second. You're going to get bodies that have way too little moisture and some that have way too much. There we go. There it goes. So embalming in general, you 3 objectives: temporary preservation, sanitation, and restoration. moisture plays a role in this. When we looked at the embalming chemistry, we saw how much hydrolysis played an effect in this. And the amount of moisture in a body is going to affect hydrolysis, which is going to affect decomposition. Whether there's too much or too little will play a role in this. So control that moisture is one of our primary concerns. A major objective of the embalming process is, again, to establish or maintain a proper moisture balance in the remains. Like I said, you're going to get them going both ways. There's 3 moisture conditions which can be present. Somebody normal, right? Then there's dehydration, and then there's edema. Moisture extremes can be localized or they can be generalized. It can be for the whole body, or it may be like the right hand is dehydrated, the left hand has edema. You just never know what you're going to get. And what, again, when somebody goes into a hospital and they're under that physician's care, a lot of times they'll pump a lot of fluids into them, to try to help them. So a lot of times you're going to get that, but again, you see that other side of it on a regular basis. The worst I ever saw was a guy that he was a local chief of police, and he was a damn nice guy. And when he died, he had a brain tumor of some sort, excuse me, and his face was so dehydrated, he looked like a skull with skin laid over it. Like, it was like, I wouldn't have recognized him. I mean, we did everything we could for him, but we would never get him back to the way that he looked. It was heartbreaking. Because like I said, he was a good person. And yeah, like I said, you just never know what you're going to see, So moisture content. There we go. So normal is 50 to 60% of the body weight. Dehydration and edema, like I said, both pose problems. And really, we're looking at like a 10% variable here, in that if you've got 10% above your normal body weight and moisture, your edema. If you've got 10% below that, then you're most likely considered dehydrated. So embalming treatments can and its effect on moisture. So we can add or reduce the amount of moisture inside of a decedent. And it's interesting when we get into it, there it is. I'll get to that 1 second here. It's interesting. The solution to both edema and to dehydration is almost the same. It's use more product, use more chemical, right? If you think about it like this, when you inject into a decedent, 50% of what you put in stays in, roughly 50% comes out. It's really closer to 37% stays in, but that's irrelevant. If somebody they have edema, if you inject in 3 gallons, or let's say 4 gallons, I'm going to use 4 gallons of solution into a person, you're going to be removing roughly 2 gallons of fluid, of their body fluids, from their body. If you're in the same situation with somebody who's dehydrated and you inject in 4 gallons, you're adding roughly 2 gallons of fluid to their body. So it's weird, but it's the same physical concept, just different ways. And we'll get into all that. Where you heading out? Are you going to go get Win? All right. And again, like with anything else, follow the manufacturer's dilution and water temperature recommendations. Edema Co is what I like for edema, for edematous bodies, and it has like almost a warning label on it, like, whoa, like be careful with this, because it's going to change the osmotic quality of the fluid, and it's going to really pull moisture out of the decedent. On the other side of it, if you use something with like a lot of lanolin in it, okay, that's going to add moisture to the decedent. So you just need to know what you are working with. This is a concept that comes up on a regular basis. Thoroughly embalmed tissues dehydrate less than under embalmed tissues. Oh, my wife left. I can sneak in. I hit off of the the vape. So thoroughly embalmed tissues dehydrate less than under embalmed tissues. So if you have somebody that's poorly embalmed, they're going to dehydrate faster than somebody that's thoroughly embalmed. You have somebody that's really, really well embalmed, it's going to almost seal that moisture in. It's one of those concepts that the book really drives home. So, like I said, just keep it in mind, you know. So 402 and 403, they have 15 techniques that they talk about how you can maintain a good balance of moisture. Pages 402 and 403. If you're using an older copy of the book, it's right in there. I just don't know the numbers. Now, let me give you an example that the book gives. Uh, Give me a second. I should have opened this up earlier, but sorry, I'm still waiting for it to open. Okay, here we go. So according to the book, 1 pint or 16 ounces equals approximately 1 pound, right? So if you inject 3 gallons of solution into a decedent, that's roughly 24 pounds. You're not going to have to repeat this back to me, by the way. It's just an example. You're injecting 24 pounds of moisture, of fluid into an individual. Well, roughly 12 pounds of that is drained out, right? So, and again, 37%, but it doesn't matter. People generally agree at the 50% on that. So you're injecting 3 gallons into someone. Well, you're pulling 24 pounds of moisture out of them, right? So, or excuse me, I'm sorry, 12 pounds of that. I keep saying 24, but 12 pounds of that. So 24 pounds, roughly half of that is 12 pounds of moisture. So you're removing 12 pounds from the decedent. Now, if you do cavity treatment, roughly 1 quart, and this is just the round numbers they've come up with. 1 quart of aspirin equals 2 pounds of moisture removed, right? So we've now removed 12 pounds while we were injecting. We're now removing another 2 pounds during aspiration, during cavity treatment. Now, the book, and I think the book gets a little extreme on this, but they say the body can lose up to 3 pounds of moisture per day by evaporation. So if you're holding onto a decedent for 3 days, that's another 9 pounds of moisture that's been removed from them. So if you add all of that up, the total moisture removed from a decedent while they're in your care is 23 pounds. So think about that. Like, that's good in a situation when you're dealing with edema. When you're dealing with something like dehydration, yeah, not so much. So it's really important to keep all of these things in mind while you're prepping, while you're doing your case analysis. The I might have told the story in class. There was a sales rep that was telling me that he had a funeral home that kept calling him up and giving him a hard time about the bodies were drying out, and they didn't like the fluid that they were using, and it doesn't put enough moisture in the bodies, and blah 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 blah. He went out to the funeral home, and they had an air conditioning unit basically blowing air right at the body. So he was like, "That's dehydrating your bodies," and the guy's like, "No, it's not. No, it's not. No, it's not." And he ended up taking a glass of water and putting it where the casket was, and then taking another glass of water and putting it somewhere else in the funeral home. And they went out and waited, and like 6 hours later came back, and the glass of water that was where the casket was like 3/4 of the way empty, just by that air current coming across it, right? And it just pulled that moisture out of that cup, whereas the other one was still completely full. So there are factors both internally and externally that you need to take into account when you are handling, storing, preparing a decedent. All right, you know what? Let's do this. I've got just about 240. I just wanted to introduce the basic concepts of that unit. and we're in a good position that we can still wrap this up well in time of finishing out the semester. So, and besides, it's too beautiful of a day to be sitting in here listening to me. Do me a favor. The one thing, and I neglected to ask this, sorry, previously, and I apologize for that. Would you mind putting your names into the chat just so I can take attendance? If you can throw them in there real quick, we'll call it a day, and we'll pick up on moisture considerations next week. And yeah, we'll take it from there. All right, good. I hope everybody has a good week. And if I don't see it, if I see another class, it's great. And if not, have a good week, have a good weekend, and have a good spring break. Remember, next week we're on spring break. So, there's that. And so don't work too hard while you're on spring break. I know it's always the thing when my boss found out I was on spring break. It's great. You're working more this week. I was like, whatever. So, all right, good. Everybody got their name in? All right. Fantastic. Guys, have a good week. And like I said, if I see it elsewhere, great. And if not, I'll see you guys on the 21st or whenever it is that we return. Take it easy, everyone. Oh, also, I'm sorry, go ahead.
No, I was going to say thank you.
Hey, sure thing. Absolutely. What was I going to say? It doesn't matter. Anyway, it doesn't matter. Like I said, guys, have a good break, and I'll see you guys on the flip side. Take it easy. And go out and enjoy this weather, man. It's a beautiful day out there.